Hey guys, today we're going to be speaking about a USMLE Step 3 mnemonic. And I want to speak about this for the CCS case of Step 3, computer-based case simulations. Now, it's a really big part of your whole overall test. So you want to make sure you have a good solid mnemonic and something that applies for every single scenario. So we're here. This is one of the great mnemonics, and it'll guarantee you guys some top marks. So I want to just speak about the mnemonic. It's going to mean car feel, TT, NU, cube, T, maple. Now, I know that sounds a little bit weird, car fuel, but I'm gonna help you remember it. Car means like you're a car when you come to the emergency department when you're getting admit, you usually come in a car like an ambulance. And then fuel means your blood, kind of like fluid. TTBBB is you're gonna be your like for example your like TB you can just learn it as tuberculosis. And new can be like a new admit, and maple cubes pubes T maple is something you can just learn easily. Second thing you guys want to know is cubes T maple is going to be Q. The C stands for five different letters. U over here stands for four different letters. B stands for six. E stands for three different tests. S stands for one. T stands for two. M stands for one. Maple. P stands for three. L stands for four. Okay. Having said that, let's come into what does all of these stand for. So first of all, I will start off with C. Cardiac C as in cardiac monitor. Okay, you want to monitor the heart. A as in your arterial blood gas, R as in random blood glucose, your F as in fluids, your I as in IV axis, O as in oximetry. Then we have over here your, let me just zoom in for a second, but we have over here your T. So you may want to transfer a different department, transfer them to for example, um, mm, to a different department or anything or maybe the ICU. And then TIBC, that means your total iron binding capacity. Your B, your bleeding time, your blood type and screen, and your B, your blood pressure. Your N, your nasogastric tube, and U, your ultrasound. So those are going to be your main ones over here. And then we're going to have your cubes 5. The C over here stands for CBC. The CMP stands for your complete metabolic panel. The CPK, carotene phosphokinase. And then the other C stands for chest X-ray. And then we can see CPR. We can see, so not CPR, CRP, C-reactive protein. Then U is going to be urinalysis. Then U is going to be urine granulation. Then U is going to be urine toxicology. And then U is going to also be urine culture. And then we can see over here beta we can see over here beta HCG. Then we can see the B is going to be blood natriuretic peptide. B is going to be blood culture. B is also going to be your blood toxicology. Then we can see hemoglobin A1C can also be here. And then we can see also your haptoglobin can also be over there. Then we can see E is going to be your ECG, or it can be your ESR or echo. S is going to be stool studies. And then T is going to be your troponins, TSH, and then M is going to be magnesium. P is going to be phosphate, prothrombin, parathyroid levels. L is going to be lactate, LDH, LFTs, and lipids. And so that's going to be the overall mnemonic. Why do you want to do nasogastric tube? What is kind of its uses? Nasogastric tube is something you keep through your nose and it goes to your stomach. You can provide medications, you can do gastric decompensation. It is used when a patient cannot swallow safely, stroke, neurological disorders, when the stomach needs to be emptied due to a bowel obstruction, vomiting or post-surgery. Common conditions include nasal acid tube, stroke, dementia, Parkinson, head, neck cancers, causing swallowing issues. The small bowel obstruction, severe burns or trauma, premature infants needing feeding support. So I want to recap this mnemonic: CAR, FEW, TBBB, NU, cubes, T maple. So we're going to be seeing C cardiac monitor, AABG, R and glucose, F fluids, I IV access, O oximetry. And then we can see the T transfer, TIBC, BDHCC, blood type and screen, and your not BDHCC, your bleeding time, blood type and screen, and your blood pressure, vasogastric tube, ultrasound, CBC, CMP, CPK, CRP, chest X-ray, urine analysis, urine culture, urine gram stain, urine toxicology, beta HCG, blood culture, blood toxicology, hemoglobin A1C, uh, haptoglobin, BNP, beta HCG. Over here, then ESR, ECG, echo, stool studies, TSH troponin, magnesium, phosphate, prothrombin, parathyroid, LDH, LFT, lactate, lipids, and that's going to be here. So that, guys, this is going to be very helpful mnemonic. Hopefully, you guys found this video useful, and I might be doing some more step 3 videos in the future. But thank you guys for watching. Hope to see you guys next time.